The opinions and statements expressed in the following program do not necessarily reflect those of WWDB, its staff, or management.
Good day, everyone. Welcome again to another edition of Boomer Generation Radio. This is your host, Richard Address, coming to you live from the studios of WWDB AM 860 here in the Delaware Valley, Greater Philadelphia, and streaming live on WWDBAM.com. Boomer Generation Radio. This segment of Boomer Generation Radio this morning is brought to you by the Kendal Corporation. Kendal is a system of not-for-profit communities and services located in 8 states in the Northeast, Mid-Atlantic, and near Midwest regions of the United States. And Kendal advocates for and empowers older adults to reach their full potential and is committed to working with others to together transform the experience of aging. And to learn more about Kendal, that's Kendal, we invite you to visit kendal.org or call them toll-free at 888-759-0128. That's 888-759-0128. And joining us on this first segment, the Kendal segment here on today's Boomer Generation Radio, is Denise Getgen, Chief Protective Services of the Pennsylvania Department of Aging. Denise, are you there?
I am. Good morning.
Hi. Nice to be with you, and thank you for calling in. We appreciate you joining us here on Boomer Generation Radio. We want to get right into this very difficult topic, and actually it's a topic that we started to talk about last week on the Kendal segment with a gentleman named Paul Greenwood from the District Attorney's Office in San Diego County, and he raised some issues about elder abuse. And thankfully, we, through our good friends at Kendal, Beryl and Bill, were able to connect with you to try to localize this a little bit more. Could you just walk us through your role in protective services for aging, the aging department here, in dealing with issues of elder abuse? Involves what? What exactly do you do?
Sure. I, like you said earlier, I work for the Pennsylvania Department of Aging, and we have oversight and administrative oversight work closely with the area agencies on aging in each county in Pennsylvania to implement the Older Adult Protective Service Act. And so it's our responsibility to implement the law at the local level. We provide guidance and policy development, funding to the area agencies on aging. So in every county, they can go out and implement the law in terms of providing protective services to older adults in need.
So this Protective Services Act, walk us through it real fast. What does it encounter? And
sure.
What does it do?
The law really provides for the area agencies on aging to be able to provide protective services for older adults deemed to be in need of those services. And that could be an older adult who lives in the community or someone in a facility-type setting. So what the area agencies on aging do, we get a call, there's an allegation of elder abuse, neglect, exploitation, or abandonment. They get a call at the local level, they go out, they do an investigation, they determine, is this person in need of protective services now or at the time of the incident? And then we have the resources to implement a plan of care to stop the abuse or to get them out of an abusive situation. So that's sort of a very broad overview of the Older Adult Protective Service Act.
Well, let me get right to the heart of something. Suppose somebody listening may have an understanding, an inclination, an observation, or a fact of elder abuse. How do they report that? Who do they call? Where do they go?
Well, in Pennsylvania, we can do a couple things. One is you can call your local area agency on aging. There is also, we have a statewide elder abuse hotline that's 24/7. That line is 1-800-490-8505. And like I said, that's a 24/7 hotline. You can call anytime. Callers can be anonymous. And again, it doesn't matter if the person resides in the community or if they live in a facility setting. What will happen if they call that line is designed to take them to the closest area agency on aging. So, for instance, if you call from my office, Dauphin County, it'll be sent to Dauphin County Area Agency on Aging. If you're calling from Allegheny County, it goes to Allegheny County Area Agency on Aging. And so that is by design so that the closest area agency on aging to the person in need can get out there and begin an investigation and services.
Could you just walk us through also one thing? These area agencies on aging, I'm going to bet that a lot of people actually do not know what those agencies are, where they come from, and how they're funded, and you relate directly to them, correct?
Yes.
Okay.
So in every county, there's an area agency on aging, and they provide older adult services that run the gamut, anywhere from Meals on Wheels all the way through guardianship. And it could be things like in-home services, long-term care supports. They do assessments for people who may be in need of sort of a program or structured service. They can do assessments as to whether someone's eligible for certain programs that we have available.
Do you ever remove an older adult from a house? And if so, where would you place them if you determine that there is actual abuse?
We have. It's certainly not our goal to do that. What we'd like to do is always be least restrictive. So what happens typically is we go out, we do an investigation, we try to get to the facts of what's happening. Is there truly abuse? And then we start to look at, well, how can we reduce or eliminate abuse? We try always to involve the older adult or their family or whoever's appropriate in the plan of care as to how to reduce or eliminate abuse or risk. But there are times, unfortunately, and in Pennsylvania we do see where there's no other alternative to removing someone from a situation now. We like to look for other family or friends that are appropriate, but there are times where someone may be in a self-neglect situation where there is no other family members, the person's very confused, unable to care for themselves, and there have been times where we need to place someone in a facility setting where they can get appropriate care and services and have their needs met. So we can do that. We always look for the least restrictive, but there are times where that needs to occur so we can best help the person or the individual.
So we're speaking with Denise Getgen, the Chief of Protective Services for the Pennsylvania Department of Aging, and talking about this very disturbing issue of elder abuse, which we have come to understand the statistics for which show an increase in around the country. And I would imagine, well, let me just ask you, are you seeing an increase in these issues in the state of Pennsylvania?
Unfortunately, there has been an increase. I've been in this position for about 6 years, and every year there's a significant increase in allegations of abuse that we receive. Last year, so fiscal year 12-13, we in Pennsylvania got 18,542 allegations of abuse.
Wow.
Of that, that's a huge number. Of that, 74% are investigated, are appropriate for the area agencies on aging to investigate, and of that 74%, about 40% are substantiated. So that leads to, okay, well, what does substantiated mean? That means the older adult was either in need of protective service now at the time they do the investigation or at the time that the incident occurred. So that's a lot of elder abuse that's going on. And when you start thinking about, okay, well, what does that mean? And what kind of abuse are we really talking about? In Pennsylvania, the number one type of abuse is neglect. It's either a self-neglect, and that would be an example, maybe two older adults no longer able to care for themselves or each other, so they're not able to meet either their self needs or their needs of a loved one. So self-neglect is our number one. Caregiver neglect is number two in Pennsylvania. That's an example of that might be a caregiver who fails to provide the necessary care and services. Maybe they're not turning and repositioning. Maybe they're not able to get the person cleaned and get them the care and services they need in terms of medication or physician visits, and they end up in a hospital with skin breakdown, that kind of thing. So it goes self-neglect in Pennsylvania, then followed closely by caregiver neglect. And the biggest rise I think we're seeing in Pennsylvania and throughout the country is financial exploitation. And so that is number three in Pennsylvania. We see an awful lot of financial exploitation. Example of that might be theft of assets, where someone may sign a farm over to themselves or just open a bank account, open a credit card with someone else's information, or it could be just really a theft of money. And we see that a lot. Unfortunately, we're seeing a lot of caregivers and even family members who are really financially exploiting older adults in that they're using the older adult's resources for their own benefit and not the benefit of the older adult.
One of the things we learned last week about, which really surprised me, and that is it's a law in California, speaking of financial exploitation, that if a bank teller, somebody walks into a bank and withdraws an unusual amount of money all of a sudden in cash, that there evidently is a law now in the state of California that bank tellers are mandated reporters if they sense that there's something out of the ordinary, which I thought was fascinating, especially in light of what you were just reporting about financial neglect. Is there a similar statute in Pennsylvania?
There is not right now. The Department of Aging is working with the legislature to look at that exact issue, whether banks and financial institutions should be mandated reporters.
Wow.
That's not something we have currently, but it is under discussion and consideration. It's a lot bigger issue. We really do want to at least work with banking to talk about making sure that bankers and tellers are trained, looking for red flags and know how. But we do have in Pennsylvania, which I think really is how we're working together now, is voluntary reporting. So under the Older Adult Protective Service Act in Pennsylvania, someone could just voluntarily report, and that's where we see a lot of banks and financial institutions reporting currently. They see something suspicious, a change in banking patterns, a lack of resources, something that catches their eye that they say, hey, something's going on here, this doesn't make sense. And they know these people the best, and so they're really equipped. They do have current training. We'd like to work with them, continue to work with them about further training and working together. And I think as well they're interested in that. They want to protect consumers as well. So we don't have a mandation right now, but we do have voluntary reporting under the current law.
Are there any other states that you know of that have this mandatory reporting statute?
There are. I think actually we're surrounded by a few. If I'm not mistaken, I think Maryland. But I think my last sort of recollection was there's quite a few states that do have requirements for financial institutions to report in accordance with the law.
And this is not only then banks, but also, let's say, you're the financial advisor or somebody like that?
That's correct.
Wow.
Credit unions, all the people who sort of have that first line of defense. They see people coming into the bank. They know these people. They've seen their pattern over years, and then they start to see a quick change, or they see assets being withdrawn very quickly, that kind of thing. So they're really in a position where they see it first.
Oh,
and a lot of times they are reporting. So we are working together now to really catch that early. And I know a lot of banks are having conversations when they start to see that to talk to the older adult. You know, and of course there's been a lot of talk about scams and not sending money, wiring money to places or people you don't know. And so they're working with them on a lot of fronts as well.
We're speaking with Denise Getgen, the Chief of Protective Services for the Pennsylvania Department of Aging, here on this Kendal segment of Boomer Generation Radio today. And this is just a reminder that this portion of Boomer Generation Radio is brought to you by Kendal Outreach, serving the field of aging by raising public awareness and advocacy around important issues of older adults. Through education, training, and implementation of comprehensive approaches to safe, individualized long-term care practices, Kendal Outreach has been sharing Kendal's approach to quality care with consumers, advocates, providers, government agencies, and related organizations since 1989. To learn more, visit Kendal.org. Again, that's KENDAL.org, and click on the icon Outreach. Click on Outreach. And that's Kendal Outreach. And again, this is the Kendal portion of Boomer Generation Radio. Speaking with Denise Getgen, the Chief of Protective Services for the Pennsylvania Department of Aging, here on Boomer Generation Radio, WWDB AM 860, and streaming live on WWDBAM.com. And a reminder, if that you want to comment on or suggest or talk to us a little bit about the program, you can email us directly at boomergenerationradio@gmail.com. That's boomergenerationradio, one continuous word, at gmail.com. Denise, how difficult is it? This seems to come up in some of these conversations. How difficult is it for when you investigate an older adult who there's some concern about abuse, that they just are afraid, they don't want to get into any trouble, they're afraid of what may be repercussions after you leave? Talk to us about that.
The area agencies on aging, when they're going out into homes, they come across this a lot where the older adult doesn't either want to admit that this is happening. They're fearful that someone will see them as incapable of living independently, or they'd want to protect a loved one who may be stealing their assets, for example. So there is a lot of fear. They're fearful of what will happen to them in terms of where will they live, who will come visit them, will they have anyone who comes to visit if they turn in maybe the only person they know who's coming to see them at all, even though they are stealing from them. So we do see a lot of that. I mean, one of the things that the Area Agency on Aging do very well in every county is to sort of get their foot in the door and talk to them about, what are the options and what kinds of things can be done. And a lot of older adults choose to just have the abuse stopped and not go on to prosecution. We do have some that choose that we do involve law enforcement, but a lot of times we're about working with the person and really dealing with how do we protect them from further abuse, and not so much really on the law enforcement, but more on the social services side of things.
The issue of nursing homes, you see these advertisements sometimes around about nursing home neglect and people being abused within nursing homes. How do you deal with that? I mean, is it difficult to prosecute a nursing home?
A lot of times what we see is there's a lot of reporting that's required in nursing homes, and so there are a lot of reports that come out of not only nursing homes but all types of facilities. And so we do the same thing we would do in the community. We go to the facility, we start talking, we look at policy and procedure, interviews, those kind of evidence gathering, that kind of thing. A lot of times we're talking to facility administrators about what's their policy, was it followed, do staff understand what their responsibilities are, and a lot of what we do is retraining. There are some times where we see that it's a bigger issue than maybe just a nurse or a nurse aide who failed to follow a care plan, but it's a bigger issue where all staff need to be retrained. And so I think we work well with nursing homes in terms of how do we stop this from ever happening again. Have there been cases where we go and we say this was out and out neglect? Of course. But I would say that that's sort of lesser than the times that we go in and we say, hey, we need to talk about this. We need to make sure this never happens again, not only to this person, but to all persons in the facility. And so we do work in collaboration with our sister state agency, the Department of Health, and the Department of Public Welfare to look at these facility-type cases and deal with them under licensing or deal with them in collaboration with protective services.
Yeah, and before, in the first segment, you did mention this idea of, which I want to return to, about the internet scam and phone scams. Could you just, how do you protect somebody who may be living alone but whose cognitive impairment may be accelerating? They're alone. They may not have that their own sense of deflector shields, so to speak, up. How does the Commonwealth deal with that? I mean, the internet scams, the phone scams.
Sure. We're working in collaboration with a lot of other state agencies, for instance, the Attorney General's Office, Department of Public Welfare, and the Department of Health to get out the word that, isolation for older adults is problematic for those reasons you just mentioned. A lot of people, want to be talking with other people or have someone in their life. And so, we talk a lot about isolation and trying to minimize that. We talk a lot and do a lot of public outreach and education about not taking calls from strangers, not wiring money, not being pressured into sales for people who come to your door, show up in your driveway. We do talk and do a lot of public outreach, both at the state level and at the local level. And so that's probably the biggest thing I could say is if you don't know these people, be very cautious of what their true intent might be, whether it's on the phone, whether it's in person. If someone's just a little too aggressive about wanting money or pressuring you into doing something or buying, even I think now we're seeing a lot of store card sort of scams. And so there's a lot of that out there, and I would just caution anyone to be involved with your loved one, your older adult, someone in your community, your neighbor, to be watching for those kinds of red flags.
What's a store card scam?
Where they have people buy these prepaid, like a prepaid debit
like a
card,
gift card or something?
And they ask for the numbers on the back, and they're redeeming that cash value, unbeknownst, of course, to the person who actually purchased it and spent the money for it. And so there's a lot of that. There's a lot of scams in terms of wiring money, and we hear a lot about the grandparenting scheme. So we do work in collaboration to try to get the word out at both the local level and the state level that people at least are aware that these things are going on, and at least to be very, very cautious about giving out any kind of personal information or banking information or card numbers, that kind of thing, to someone you don't know.
So this raises a question with me, and you sort of like alluded to and your first level of instances, this self-neglect. Mm-hmm. My sense is, in my experience working in a lot of the aging area, there's a significant amount of loneliness and a significant amount of isolation. You alluded to this as one of, and is a contributing factor of this self-neglect. How much of this, see if I can phrase this correctly, how much of this self-neglect is at the heart of this just a desire to talk to somebody, to feel that you have a connection with another human being, as opposed to just staying in my apartment or my house all by myself with no one really talking to me?
Absolutely. I think you hit it right on the head. I mean, there is a tremendous amount of just loneliness, exactly what you said. And that's why it's so important that people remain active in their community and that there are programs, for instance, through the Department of Aging or even local programs that really get older adults involved and that they have a sense of community and that they remain active in that community, whether it be just a very small circle of friends or a larger circle, things like a senior center or a gym or something where they have interaction. But there is a tremendous amount of loneliness, and it's so important that we're reaching out to, like I said, neighbors and friends and people that you've known for years because they live down the street, and that we keep them involved. It's so important for all of us. But we're seeing, fortunately, I think we're seeing a little bit more of intergenerational living, and so we hope that through some of our programs that people are really remaining active in their communities, and that's one of the things the area agencies on aging do very well at the local level on behalf of the Department of Aging.
We're going to run out of time in a couple of minutes, so and you just mentioned this intergenerational issue. Could you just speak, in your experience in running the protective services for Pennsylvania, are there major differences in cultures and ethnicities of how different cultures approach this whole elder abuse or care for aging? And are there cultures that really do not allow their older adults to be isolated and alone?
I think there are some cultures that there's a lot of intergenerational living, but I think we're seeing more and more with the economy the way that it is. There are a lot of people sort of coming together with their resources, and what we see is maybe that's a good thing for all of us to have kids living with their parents, with grandparents in the home. And so I think there is some cultural things going on where there's a lot of families who live together, and that's sort of a cultural thing. But I think it's also based on our economy right now. So we're seeing some of that as well.
Do you think so? In other words, the recession has contributed to a decline in elder abuse?
I wish that was true, but I think what's happening is that there is people living together, and sometimes that's a very good thing, and it doesn't lead to elder abuse. I think there are, of course, always cases where people have other ideas about what they want to do with other people's resources, but I think living together sometimes can be a very good thing in keeping people active and vibrant and sort of very involved with both their community and their family.
This may be a little off-the-wall question, but do you get involved, or can you be proactive if, let's say, a nursing home or a facility sees that just nobody is visiting a person, just no one, they're just warehoused, to use that horrible term? Can you be proactive and get involved with the family, saying, please go visit your relative?
Sure. I think in facilities, there's a lot of that go on through their social workers and through volunteers, which is another great program where a lot of facilities are getting a lot of volunteers to come in, because sometimes people just don't have family or don't have friends that can come and visit them. And so there's a lot of volunteerism, which is a great thing for all of us to be out and working with older adults. And again, a lot of volunteerism is intergenerational, so that's another good thing that I think we can all do to combat some of that loneliness or, the potential for abuse when someone's sort of isolated. So that may be a very good thing to consider, all around in all types of settings.
So thank you. Denise Getgen, we have been talking with Denise, who's the chief of the Protective Services Pennsylvania Department of Aging, on this rather fascinating and disturbing in most ways subject of elder abuse. And once again, Denise, if someone is listening and they want to get in touch with you, the 800 number is what?
1-800-490-8505.
And what other ways can someone access you?
You can call your local area agency on aging and ask for the Protective Service Unit. Those would be your quickest ways to get someone assistance, or at least having someone show up and look into what your concern might be. So
once again, that's 800-490-8505 to connect you with the Protective Services of the Pennsylvania Department of Aging. Denise, thank you very, very much. A lot of information, a lot of great information about a very disturbing subject. I wish you well. Have a great rest of the day. Thank you for joining us here on Boomer Generation Radio.
Thank you. It was great to be on.
Thank you. And this portion, a reminder that this portion of Boomer Generation Radio has been brought to you by Kendal, a system of not-for-profit communities and services that advocates for and empowers older adults to reach their full potential. Together, we're transforming the experience of aging, and to learn more about Kendal, that's Kendal, we invite you to visit kendal.org, or again, call them toll-free at 888-759-0128. That's 888-759-0128. And visit them again at kendal.org, the Kendal Corporation.